Here is your question.
Yes, ma'am, I'm ready.
You ready? Okay. So if you have read and understood, considering it surgical pathology station, please begin and tell me what would be the provisional diagnosis you will consider.
I think rheumatic heart disease
Okay. Why would you think it's rheumatoid heart disease?
because patient is a young female with shortness of breath, low grade fever, and joint pains.
Okay. What is the demarcation or difference in rheumatoid? Okay, what are the differential diagnoses you'll consider for this patient?
Uh, Patient can have pneumonia
Yeah.
or infective endocarditis.
Okay. How would you differentiate between rheumatic heart disease and infective endocarditis? What is the
Uh,
criteria to determine each? Please, in other simple words.
I forgot that.
Come on, Jones criteria. Please tell me.
Ma'am, I did not read that. I only read infective endocarditis.
Come on, you are differentiating. You wrote, okay, please tell me, right. Why would you think, okay, what is the pathophysiology of this illness?
It is due to the infection due to the microorganisms
Which
that
organism?
Streptococcus viridans or Staph aureus or some Streptococcus bovis or any enterococci.
All right. Okay, you've told me this is because of inflammation. Please tell me the process. What would be the gross findings you'll
Uh,
see?
in rheumatic heart disease, acute rheumatic heart disease, there are warty inflammatory vegetations at the valve line of valve closure. That
This is the acute phase, and what happens in the chronic phase?
in the chronic phase there is fibrosis and there is commissural fusion and also shortening and thickening of the chordate
Chordae yes.
stenosis and thickening and the shortening of the chordate tendon.
Which, if you'll do echocardiogram, it will look like a fish mouth deformity.
Yes.
Okay, yes. Right. How do you think you should go about and manage this patient?
I will manage the patient with the antibiotics like ceftriaxone or vancomycin for 6 weeks.
And
After and if the patient is not settled, then we can offer them valve replacement or heart transplantation.
okay, are there any okay, right. So macroscopically, what would you find on the valves or in the patients?
Ascough nodules or fibrinoid necrosis.
Okay, what is most important to keep in your mind post-operatively? Just suppose if you go ahead and you choose to replace the valve of the patient. Before that, first, please answer which are the valves which are most commonly involved in patients with rheumatoid heart disease.
Mitral valve is or and the aortic valves are more
Yeah,
involved.
sometimes even tricuspid. Okay,
Yes.
right. What is something that you would have to keep in your mind when you choose to replace the valve of the patient?
Because after valve replacement, thromboembolism can
Occur,
be the
yes.
problem.
Yes.
I would put patient on warfarin.
Okay, but you'll not begin with the, okay, what would be the most common anticoagulant you'll choose and why?
I would choose warfarin as anticoagulant.
Yeah, you can't choose warfarin right away because in post-operatively you would give heparin. Then you would have to choose which heparin to give, low molecular weight heparin or unfractionated heparin. Then
I
you'll
will
go,
give
you'll
low
taper it, and
molecular.
then you'll give warfarin. Okay, what are the or which are the inhibiting vitamin K inhibiting factors which are
Two,
influenced
seven,
by?
9, and 10 are the
Yes,
vitamin K present.
yes, good. Okay, if you would have to, by any chance, like there is post-operatively, there is paravalvular leak of the patient, and patient is again dyspneic and symptomatic, and you would have to operate on the patient. And for that reason, you would have to reverse the anticoagulant that you have given. What would you do? What
First, I'll
measures
give
would you take?
first I'll give vitamin K to the patient. I can
Okay,
also give FFP, fresh frozen plasma, or in
right.
emergency case, I will give prothrombin concentration complex.
Okay, what is cryoprecipitate, if you can please tell me?
It is factor 8 or
Only
factor 8 and 9 are cryoprecipitate.
9 and 12 as well. Fibrinogen, which factor is that?
That is 9, ma'am.
9.
Fibrinogen is factor 9.
Okay. Right. But before you'll do that, you'll also make sure you'll check INR. What is the significance of making sure or checking INR in a patient who's taking warfarin?
Uh, INR is to monitor the function of the effect of warfarin.
Yes.
Uh, if it is more than 1.5, uh, that may be considered as more prone to the patient to be more prone to bleeding. So we need to keep warfarin between 1.5 and 2.5, I think.
Okay, please tell me, why would a patient who had rheumatic heart disease and underwent heart valve replacement are more susceptible to infective endocarditis than a person who has not been operated?
Because normally the blood flows smoothly over the valve, but a valve replaced valve has more turbulent flow and which causes more colonization of bacteria.
If right, you did mention the antibiotics that you were giving. If you are excuse me, you are continuously giving those antibiotics to the patient and patient's symptoms do not resolve, what would you do despite you have given long-term antibiotics?
I would do the valve replacement or heart
You've already
transplantation.
done valve replacement. Now
I
you
will
are,
do the heart. I will go for heart transplantation.
oh, okay. Right. How would you know? Okay, normally the aortic valve is, how many cusp does it have?
3.
3. Right. Sometimes aortic valve presents with 2 cusps. It's called bicuspid valve. How stenosis occurs when aortic valve is bicuspid? Please explain the
Uh,
procedure.
because there is more mechanical pressure over the bicuspid valve as compared to the 3 cusps, which causes it to stenose. And also, yes, this is the reason.
Okay. Right. Please tell me, why does a patient with bicuspid aortic valve dies or has sudden death? What are the 2 causes, most common causes which has been observed?
Aortic rupture or myocardial infarction.
Okay, what
Aortic,
is aortic rupture called in our medical
aortic
terminology?
dissection.
Yes.
Aortic.
Okay. Right. Tell me, what do you understand by the term virtues triad?
It is stasis of the blood, thrombosis, and
And it's
uh,
most commonly seen in patients with the metallic valve.
Yes.
Right. Okay, one last question, please. Tell me, what are the features that you look for in a patient who has rheumatic heart disease and their valve was replaced? Then you are doing 2D echo, two-dimensional
Yeah.
echo.
In 2D echo, we would see valvular regurgitation, ventricular dilatation, and regurgitation. We can see annular dilatation, and we can see regurgitation jet of more than 1 centimeter length and peak velocity of 2.5 millisecond. There could be also collapse of the leaflets.
Very good.
And
And
nodule
thickening.
and decreased mobility, and also there could be elongation or rupture of the chordae tendineae,
Right.
and there could also be subvalvular apparatus hyperechoic
Very good. Okay. Cool.
apparatus.
Yes, good. Right. Okay, I think I have asked you. Okay. When it comes to infective endocarditis, there is a criteria called Duke's criteria, major and minor. Would you be able to tell me that?
Yes, there are two major criteria. One is about the two positive cultures consistent with the infective endocarditis microorganism of 12 hours apart, or persistent positive blood culture, or patient if has one positive blood culture for Coxella burnetii, or there is phase IgG titer of 1 to 800, and there are on echocardiogram endocardial findings are consistent with the infective endocarditis, which consists of abscess or partial dehiscence of prosthetic valve, or a new onset valvular regurgitation.
Okay,
And
what are
minor
the
criteria,
Yes,
yes,
please continue.
minor criteria if patient has any heart disease or is IV drug abuser,
Yeah.
if patient has fever of 38 degrees Celsius, and then there is vascular phenomena if patient has arterial emboli or pulmonary embolic infarcts, or patient have any Jane's Way lesion or hemorrhage or myocardic aneurysm,
Okay, good.
and
Thank you.
immunology.
Yes, what are the different types of endocarditis that you know about?
Uh, there is bacterial endocarditis, non-bacterial thrombotic endocarditis, Libman sac endocarditis.
Okay, right. Okay, I've asked you. Okay, one factor that I would want you to remember, just vaguely, that if a patient who presents with rheumatic heart disease and then has fever, even if it's low grade fever, then you think, okay, now situation is becoming complicated. Now it could result into infective endocarditis. Thank you.
Okay, thank you.